age of 40 onwards, the risk of getting a breast cancer is higher, and most certainly from the age of 50 onwards. If you look at most of the screening programs, both locally and abroad, they normally recommend starting with one's first mammogram from the age of 40, and then and doing it annually thereafter, because of the risk being so much higher.
Mm-hmm.
Of course, in genetically driven cancers where patients may have a genetic mutation, some patients or people may have heard of BRCA mutations, which can be passed on from one generation to the next. It would be important to screen some of these individuals a lot earlier, but as a standard of care, from the age of 40 onwards, the risk in the general population does increase quite substantially.
Okay, and I think a lot of people are wondering this, Dr. David. Can males actually get breast cancer?
Certainly, yes. So male breast cancer is a very well-known entity. It's exceedingly rare, but it does occur, and it is treated in a very similar fashion to female breast cancer. The risk is certainly higher in male persons who have BRCA mutations, so those would be those genetic mutations that I mentioned. And in these individuals, it would be important to screen male individuals for breast cancer. But for the general population without these genetic mutations, because this kind of cancer is so rare in men, there's no need to routinely screen or to routinely examine all men to look for this cancer.
So obviously it's just the ones that are carrying this sort of mutations.
Absolutely, yes.
And how would they find that out initially anyway? That they probably have mutations that could lead to cancer.
Well, I think family history is often very telling. So if one has quite a few first degree relatives affected with cancer, and it also does not have to be breast cancer. So a male individual with breast cancer may have female relatives with breast cancer or even ovarian cancer. In other instances, colorectal and other malignancies may also be implicated in certain genetic syndromes. And very importantly, in inherited breast cancers, oftentimes you find that multiple generations are affected. So it's important to delve into quite a lot of detail in the family history, and to ask about aunts and uncles, cousins, grannies, and grandpas as well, to find these patterns of genetic spread.
Okay, and just talking about that, Dr. David, hypothetically, you have a long line of people in your family who have the disease or had the disease, that sort of thing. Is there a great percentage, depending on how many family members before that contracted the disease? Would it be something that, looking at it percentage-wise, you stand a much greater risk? So like 60% of the family,
Mm-hmm.
then would it be, advisable to make sure that it doesn't like skip generations or anything? Can it do that?
Well, the genetic pattern of inheritance for breast cancer generally does not skip generations, because
Mm-hmm.
it's a dominant gene that's passed on.
Sure.
In other genetic syndromes, those diseases can skip generations, but certainly for the breast cancer syndrome, so that it's more common to see that every generation has some individuals being affected. Yes.